Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
So join me in welcoming our guest. It's Miss Amanda McKissick. She is the administrator for Homestead Hospice and Palliative Care. Amanda, welcome to the show today.
Thank you, Jeannie. I'm so glad to be here.
So Amanda, tell us a little bit about how you ended up at Homestead Hospice and a little bit about Homestead Hospice.
I've been there off and on for about 5 years since they opened.
And where is your office located?
Our office is now in Cartersville, Georgia. I started out at our Norcross location, which has since moved to Roswell. I was one of the first directors of nursing at the Roswell location. And as we've opened branches, I've been real excited to be able to be a part of that and help other offices open and grow. And now I'm located in beautiful Cartersville, Georgia.
You know, Cartersville is really cute. I had the pleasure of being up there this past weekend. I went to the Appalachian Grill. I now know there's a term in Cartersville called Under the Bridge.
Yes,
right?
there is.
Yeah.
Yes, there is.
It's the cutest little town, and driving by, they had a little boutique with a cute little... I like the jackets and the coats, so very nice. So you have an office in Cartersville, you have an office in Roswell, and where are your other offices located?
We have an office in Noonan, an office in Jackson, an office in Athens, Georgia. In addition, we have an office in Arizona, which I also had the pleasure of visiting a few times.
So I know Homestead, I'm familiar, but Homestead Hospice covers all of Greater Atlanta and the Athens area.
Yes, it does.
And your Cartersville office, what specifically do you cover out of Cartersville? You run the office in Cartersville. You run the team that takes care of the patients. And so where is your team taking care of patients?
My team is taking care of patients from Douglasville to Dalton, but nothing inside the perimeter. So it's kind of, if you take a long triangle right outside the perimeter, that's us, that's Cartersville.
Okay, now that we've talked about the geographical area that your office covers, let's tell the audience about hospice a little bit more. What does someone get when they choose hospice as a plan of care for their loved one?
I'm glad you asked that. The care is usually directed by the attending physician. He decides that someone meets the minimum Medicare guidelines for hospice, and they turn care over to our team while they still direct and kind of manage the care from the background.
And that's important because sometimes people don't want to give up their doctor, and they don't, even though they need hospice, they don't want to lose their doctor, so they choose not to have hospice. And what they need to understand is hospice is just working with your primary care physician. You're not going to lose them.
Yeah, absolutely, Jeannie. What that allows is for the attending physician to have eyes and ears in the home, at the bedside, wherever the patient lives. If it's in an assisted living facility, a skilled nursing facility, what he does is he manages the care through our team of RNs, LPNs. We have CNAs that go out sometimes as many as 5 and 6 times a week and help with the activities of daily living. Registered nurses go out and kind of manage the medications, manage the symptoms, and those are the ones who report back to the primary care physician. We have social workers who go out and assist with any end-of-life needs, any applications that have to be processed for any type of extra funding or applications to change location, or sometimes they just go out and do a little counseling. The chaplains go out as often as they need them to, and sometimes they just sit and visit. In addition to that, even, we have our hospice physician who goes out after the first 6 months. He must go out every 60 days, but even before then, if there's some symptom and they can't get to their attending physician or they don't have an attending physician, our physicians go into the home, make like the old-fashioned house calls that doctors used to make.
And I know that, as you mentioned, the doctors going out into the home, there are new hospice regulations that say that the hospice doctor also does have to go into the home after the first 6 months to see the patients on a 60-day period.
Yes.
But that brings me to Homestead Hospice, because I am looking at your 5-star care program cards. And what I'd like to do is, for the folks listening, you can't really see the cards, but Homestead Hospice has come up with a program of care that goes above and beyond what the regulatory standards are for hospice care. And so if we look at the standard regulatory hospice services, much of what, Amanda, you just said, Every hospice company has to provide a hospice physician to oversee the care during their team meetings every other week. They have to provide nurses to do nursing visits. And what is that? Under regulation, once every 2 weeks.
Every 14 days. That's all they have to provide.
And they have to provide nursing assistants, social workers, chaplains, volunteers. They have to have on-call nursing available 24/7. And all medication, DME supplies, and equipment for the hospice diagnosis is covered once you choose hospice, all paid for by Medicare or Medicaid or private insurance. And that's important to know because just basic hospice services is going to provide you folks to come into your home, help keep you out of the hospital, pay for equipment, supplies, medications related to the hospice diagnosis that you may be paying for already if you meet criteria for hospice. But above and beyond that, Homestead Hospice has come up with a superior proactive approach to hospice care. And then above that, they've come up with their 5-star care program based on every diagnosis. So, Amanda, I'm going to ask you to talk a little bit about that because we want the audience to know, don't fear hospice. If you need it and you need the help and you want to stay at home, this is how you can stay at home. And there's lots of great care being given. So let's talk about what makes Homestead a little bit different from the regulatory requirements for hospice care.
The 5-star program is something that we came up with and we're really excited about.
It says here that your superior proactive care from Homestead Hospice talks about how you give more, like you were saying, more visits from the physician. Do you want to talk a little bit about how often the physician goes out to see the patients from Homestead?
They go out monthly for pain and symptom management. Depending on the diagnosis, some people may or may not want a physician in their home every month. And what we do is we offer this care when we don't mandate this care. But the physicians will go out monthly for symptom management, particularly for anyone who's having a symptom that's not under control.
I'm reading about this continuous care guaranteed upon admission, depending on patient acuity. Do you want to talk a little bit about Homestead Hospice continuous care? Because I know being in hospice, and I've worked in hospice for a long time, that can be the biggest separator from one hospice company to another. You all, at Homestead Hospice, continuous care is provided upon admission if the patient has an acuity that needs continuous care.
Yeah, and the continuous care program, and many hospices say that they do continuous care, but I've never seen anyone who does it like us. The guidelines are when a patient is having a symptom that's not under control, or pain, difficulty breathing, a fall where we need to do hourly checks to make sure everything is going okay. We'll send LPNs, CNAs, RNs out to the home, and we'll do an hourly amount of care continuously, maybe 24 hours, 48 hours, until we have that symptom managed.
And let's talk about that a little bit, because one of the things I know when you're meeting with families and you're meeting with patients, they don't understand that hospice is not 24/7. It's access to care 24/7, but they're not going to sit with you 24 hours a day, 7 days a week. So what you're saying is when they have a need, when the symptom is exacerbated or there is a crisis with the symptom, you don't have to call 911 and go to the hospital. Call hospice and they'll come out and sit continuously until that symptom's under control, correct?
Yes, that's correct. And, even hospital discharges, and we consider teaching to be a part of our continuous care program, a big part. So if we're going to see someone in a hospital and they've agreed to come home with us on hospice, 99% of the time they'll allow us to put continuous care out there in that home. And what we're doing is teaching the family. Teaching is a big part of our continuous care program. Let's say you have a loved one who went into the hospital and their condition has changed greatly. Now they need care in the home 24 hours a day. What are you going to do? How are you going to bring this person home? Well, we'll come out on a 24-hour basis, 48-hour basis, and our nurses will teach you how to care for them, how to fill up med boxes, how to make out schedules, whatever needs to be done. We'll get that teaching completed, and we won't leave the home until our families feel comfortable that they know how to care for their loved one in the home.
And I know that is different from a lot of hospices that, might do the continuous care for a few hours. But I remember just my own personal story, taking my dad home from the hospital who was suffering from lung cancer and all the different medications and just being overwhelmed and not being able to get a handle on, okay, when is he supposed to get this med? And what did they say about this? And don't put these together. And he has to eat before he takes this one. it was very, very overwhelming. So to have somebody there for the first 24, 48 hours, even just to get all of our family members on board so that we all knew while we were rotating the care, what a help that is to have someone there for that first day or two.
Yeah, exactly. And that's what we go in with, the goal of staying in until the family feels comfortable. We don't leave until we know that everybody is okay.
Now, I'm reading on your card, the next bullet point, which says the watch list program for proactive care to minimize rehospitalization. We talk a lot about hospice because I have a hospice background as well. And I know the goal is always to keep people out of the hospital and keep them at home. Do you want to talk a little bit about the watch list program and how that helps you with your proactive care approach?
The watch list program is an interesting program. We utilize it a lot for patients who don't necessarily need continuous care or haven't reached the point yet where it's come to continuous care, but we know that we need to keep an eye on these people. So what we do is every day they get a visit from an RN or an LPN once they're on the watch list. And every evening, they get a phone call from the nighttime on-call nurse to say, how is mom doing? Is everything okay? Did she take her medicine? Was it helpful? Was it not helpful? So we're identifying problems before they start, identifying symptoms that we need to manage before everyone gets panicked.
And that way you can get a 24-hour care team in place if that is what is deemed necessary. So You're watching people before the crisis occurs.
We're watching people before the crisis occurs, and so that when we do need 24-hour care, we're already well aware of what's happening, what the reasons are, and we can get somebody out there much, much quicker and get things going.
And now I'm familiar with Homestead Hospice, but I'm going to ask you this because I know this is a huge differentiator. It talks about the superior approach that Homestead gives by discussing the alternative and holistic therapies such as massage, art, music, dance, to provide comfort. Do you want to talk a little bit about those alternative therapies that Homestead offers?
We have some really, and I can't think of any other way to say it, but fun. I mean, when people think of hospice, they don't think of fun, but we have some really fun programs at Homestead Hospice that our patients, our families, our facilities really enjoy. We have dance therapy. We have a lady who comes out and does Middle Eastern or so belly dance. It's all very tasteful. She's very covered, but it's a lot of fun. Families love to see it. Facilities love to see her coming. Her name is Asha, and she makes her rounds and she travels from place to place. We have art therapy. We go into homes, to facilities. We paint. We have these beautiful little net butterflies and little sets of paint. We paint, we draw for our patients who have dementia, Alzheimer's. Sometimes we'll do things like string macaroni necklaces. We were actually doing that the other day, and they really, really enjoy it. Just the simple getting them engaged and stringing a bead through a piece of yarn, it kind of brings them back for a few minutes.
And empowers them because they're able to do their own task, which is wonderful.
Absolutely.
And I know because I've participated too, you have karaoke machines and you have karaoke will travel.
We sing and dance like nobody's business, from our case managers right down to our CNAs. And we love that we have just about worn out 2 karaoke machines in the Cartersville office. So we'll come out, we'll sing, we'll dance. We have all of the old songs, all of the new songs.
And you hear hospice is not about dying. Hospice is about living each day until there are no more days left. And I love the alternative therapies that Homestead offers because you really are living. You're putting smiles on faces. You're bringing enjoyment, and you're giving memories. As a matter of fact, I had the privilege of participating with one of your reps, actually, Millie, at an assisted living facility in Rome on Valentine's Day. I met her about 6:30 that night, and she put on a Valentine's dance for the residents of this one assisted living facility, and there was a grandson just dancing with his grandmother who was in a wheelchair, and he didn't care. He was just pulling it back and forth. And there was a wife who had come to dance with her husband who had dementia, but you could see that he recognized her, and he was stroking her cheek. And Millie and I looked at each other and said, we'd give up 10 Valentine's Days for the experience of watching that kind of love from those family members to those residents. And I got to tell you, I felt like we needed to do last call and put the lights on and off at 10:30 because nobody wanted to go home. So what a beautiful Valentine's Day I had. And it was just a testament that, you know what, hospice also brings life while you're living.
Absolutely, it does.
Now let's talk, because we're talking about your proactive approach to care. That's not even your 5-star program, but it's just so many wonderful things offered by Homestead. Let's talk about your journey to healing, your 6-week grief support group, because that is so important for the family members of the patients that are on hospice or were on hospice.
We put on a 6-week-long support group. We do one every quarter at every office. It's led by our chaplains and our spiritual care coordinators. Any family who will come, and they really do try and talk people into coming, they sit and we have a 6-week-long program. We serve refreshments, and people just have the opportunity to bond together and talk about their journey, their hospice journey. And sometimes, this is not even necessarily for family members of patients who've died. We have some family members of patients who are still with us who have attended this support group just to meet other family members and feel like they have a kinship with them.
And this does not have to be family members of Homestead Hospice patients.
No.
It can be anyone who lost a loved one in the last year or any time, right?
Yes, this program is open to the general public. Anybody who's lost a loved one at any time. Not every time you lose a loved one do you get 6 months warning.
Now, if someone's interested in participating in your next 6-week bereavement program, can we shout out what number they should call and who they should contact regarding the upcoming bereavement support groups? Because I know there's a need out there.
Yes, absolutely. It's 877-355-4472. That number will connect you with the office that is appropriate and closest to you.
That's the central location.
That's the central location,
know.
and they'll let you know which office is closest to you, take your information, and one of our spiritual care coordinators will get back with you and schedule you in.
Just to recap a little bit here, we're talking with Amanda McKissick, who is the administrator of the Homestead Hospice office in Cartersville, Georgia. She is talking about Homestead Hospice and hospice in general and what they provide. We talked about the fact that doctors will come and visit patients in the home, and nurses come in the home, and social workers and chaplains and home health aides and volunteers. And there's a whole lot of support for people who have a terminal illness and their families. They're not just treating the patient, they're treating the families as well. Amanda, before we get into the 5-star specifics, we did talk about the regulatory requirements of how often people come into the home. Let's talk about how often Homestead offers nursing services and CNA services, and how often someone can expect to see the social worker or the chaplain.
For our part, we let our families guide our care. All of our programs, all of our 5-star programs are very family driven. So if that family needs a lot of support, if they need a nursing visit every day, we will have a nurse in that home every day. And there are families who do need that support, who want that support. If that family is very kind of, let us do our thing, get us settled in, get us going, and then let us do our thing, then we'll back off. We take our cue from them. So our CNAs go out anywhere between 1 and 7 days a week. And they stay and complete everything that they need to complete. Our nurses go out between 1 time a week and 7 times a week. Our chaplains, our social workers, they go out as often as the family would like to see them. There are some families that don't accept social workers into the home, not because that they don't like them, but because it's too many people, it's just too much for them. And that's okay too.
And that's a good problem to have, too much care.
Yeah, and we get that sometimes. We get calls at the office like, okay, I love you guys, you're great. It's time for us to be alone with our family now. And I find that to be awesome. That means we're doing a good job. We're getting people set up. They feel confident, they feel comfortable, and that's our goal.
And then when they need you, they'll call you.
And they always do, yeah.
Now, if someone does need you, because there is a 24/7 line, how soon can someone get out there if they call and there's a need?
The maximum time we take to get anywhere, because we have so many locations, is an hour.
Okay, great. Again, you're talking with Amanda McKissick, who is the administrator for the Homestead Hospice office in Cartersville, Georgia. But Homestead covers all of Greater Atlanta and the Athens area, and also in the Greater Phoenix area of Arizona. And Amanda did give you the 800 number. If you need help or know of anyone that needs the help of hospice, you can call their 800 number and they'll make sure the correct office gets in touch with you. And that number again is 877-355-4472. 4472. And we're here with Amanda talking about Homestead Hospice and their proactive approach to hospice care and their new 5-star program. So stay tuned, and when we come back, we'll be right back after this quick break to talk about the 5-star program by diagnosis that Homestead Hospice and Palliative Care has just rolled out.
Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
We're back with Amanda McKissick, the administrator for Homestead Hospice and Palliative Care. I'm Jeannie Pete, and we're talking today about hospice, the benefits of choosing hospice if you have a loved one or you are sick with a terminal illness and need some help. And Amanda has talked a lot about the folks that come out and help you in the home, and that would be a doctor, nurse, social worker, chaplain, home health aide, volunteer. There's a team of people that come out to make sure that the hospice patients are comfortable and living each day to the fullest. We talked a little bit, Amanda, about your proactive care approach from Homestead Hospice, which includes continuous care upon discharge from a hospital, or if there's a crisis occurring, people will come in the home and stay 24 or 48 hours or until that crisis is averted. The watch list, how you make sure that patients are checked on before crisis occurs so that you can get a team in there if necessary. We talked a lot about how hospice takes care of medications, equipment, and supplies that are related to the hospice diagnosis, and your 6-week bereavement program called The Journey to Healing. That's offered for not just Homestead Hospice patients and families, but families of patients, but to the public, anyone who needs help and grief support. So Amanda, let's talk now about your 5-star care program that is offered by Homestead Hospice. Who is the 5-star care program designed for?
The 5-star care program is designed for our patients and families of specific diagnosis. And what this is it's just kind of a guide. It's a pathway to let people know what we're going to do for them, what we have available. Let's say we have a cancer patient. We've mapped out the care that we're going to provide for our cancer patients as opposed to our other diagnoses. We're going to do things like provide an on-site psych assessment by a nurse practitioner or a physician for the patient, for the family, for depression. We're going to do things like individualized emotional support for family members and caregiver respite. We have at our Cartersville location a cancer support group that we actually get the patients to. If they have to be transported, we transport them. If they have to have specialized nurses on site, then we have specialized nurses on site. And we've done this program a few times, and it's a great support to cancer patients who are still up, or they're still walking around. They get to meet each other and support each other.
And they may go through a different journey.
And they do.
Than someone with a neurological disease or a pulmonary disease. And so what Homestead is doing is they're offering patient-centered, specific, and family-centered, specific care to target the needs of folks through the journey of having cancer. And we know that that's very different from a loved one who might have dementia. So let's talk about some of the ways that we target at Homestead Hospice patients who have cancer. You mentioned support groups and making sure that they have the availability to attend, to discuss what they're going through and some of the emotions surrounded by that word in and of itself. What other things does Homestead offer to cancer patients that might be a little bit different or targeted because of their diagnosis? I'm reading on your on the card here, palliative chemo and radiation therapy provided for pain management. You want to talk a little bit more about that?
Yes. Sometimes, particularly physicians who have patients who have cancer are a little bit reticent. They're hesitant to let these patients and these families go to hospice because there are some tumors that are very painful. And what we're saying is this, still come to hospice, still get all the care that we can provide you and help you with in the home. But if you need palliative care for pain or symptom management for these particular issues that actually cause you pain, then we'll provide that in the home. We have 2 oncology certified nurses in our Cartersville location who can assist with that. We'll also send people out for radiology to get radiation therapy particularly if they have any type of a spinal compression, so they can shrink those tumors enough to be comfortable.
And so I know this is where you see such a variety in offerings by different hospice agencies, no matter what the market. We talk about Georgia a lot. We're also in the Arizona market in Greater Phoenix. But any market I've ever worked in, this is where knowing what questions to ask is going to benefit you the most, because not all hospices are the same. And so regarding palliative chemo and palliative radiation, because we know that that's not covered or paid for the hospice company is really incurring those costs. How much radiation therapy and palliative chemo will the hospice provide for patients? Because you also have to have the mindset that you're not seeking a cure. It's just purely for comfort. So let's manage folks' expectations and let them know you can't be on chemo and radiation for months and months and months at a time, is what I'm getting at. Let's tell them the parameters. What's typical?
Well, it's very patient specific, but what's really typical is I will speak with their oncologist and we will agree on an amount that will keep these particular symptoms at bay. It's usually 5 visits, 6 visits, 5 or 6 chemos, depending on the agent, over the course of a few weeks.
Which is very important, because you don't have to finish the chemo in order to bring hospice care in. And it's a nice transition if you're having those last few chemo treatments, getting to know that team of hospice before you're not going back to the chemo. I know my dad got very, very comfortable with the chemo nurses and actually mourned not going to the office after 2 years, and having the hospice come in and allow them to get to know the folks and work with my dad and pull him back into the home. The transition from seeing those chemo nurses every week to seeing our hospice nurse was much better for my father, instead of just waiting until he didn't have it anymore. Do you see that a lot?
We do see that a lot. And we see a lot of patients, a lot of families that are so attached to their oncology practice in general that, you know, they still need to go back, and we allow them to do that. We allow our patients to go back, see their attending physicians, see their nurses. If they need to have those few last treatments of chemo, of radiation, we allow them to do that. We allow them to ease into the home.
Okay. And then I'm also looking at the 5-Star Care Program offers specially trained nurses in IV hydration and antibiotic treatments. Do you want to talk about that? Because I know not all hospices do the IV hydration.
You know, and I forget about that because we don't deal with a lot of outside agencies. There are a lot of hospices that can't and that won't and that cannot safely perform IV therapy in the home. We can, because we have several IV certified hospice nurses, chemo certified hospice nurses. We can do the specialized ports, the PICs, the peripheral lines. We have the knowledge, we have the supplies, and we will, if the oncologist deems it to be so, we will hang fluids in the home. We will hang antibiotic IVs in the home.
Can we digress a little bit on this topic and talk a little bit more about it, though? Because I do want to educate. The whole purpose of Better Living, which is brought to you by the Homestead Hope Foundation and sponsored by Homestead Hospice, is to educate and inform seniors and their loved ones, and really all of the communities, about the options for care. And IV hydration is a tough one. I don't think everyone knows what having hydration when the body cannot handle it, how that can impact the body and the patient's comfort. So can we delve into that a little bit?
Well, that's where it goes back to teaching and, you know, the patient and family relationship with the nurse. We don't have a hard and fast policy on hydration one way or another. If someone is dehydrated because they've been sick, because they have had a fever for several weeks, they've had, you know, bowel irritations, and they're having trouble swallowing or they're having trouble getting in the amount of fluids that they need, to hang a small IV might perk them up, and we can consider that to be a comfort measure. If someone is dehydrated because they're no longer swallowing and they're not going to wake up, well, that's when the teaching comes in. We'll go out and we'll talk to the family. Our physicians will call or come to the house, and they will tell you, you know, there are times when it's more dangerous to hang an IV and it's more harmful than good. And the line to us is pretty clear. But we always have to sit and talk to our families and explain to them, and that's why it's important to get people on hospice sooner rather than later so they can build that trust with us, so they can understand that, we have their best interests at heart.
Help them stay comfortable.
And help them stay comfortable.
And bring the family a sense of peace in their decision making too.
Mm-hmm. And if an IV, particularly in a cancer patient, is going to make them more comfortable, of course we're going to go out and we're going to do that. But if an IV is going to cause more harm than good in a patient with, let's say, Alzheimer's, dementia, that can cause more harm than good. So we're going to go and we're going to talk to this family and we're going to educate them. And 9 times out of 10, families make the correct choice. It's just a matter of education.
Mm-hmm. Well, you mentioned dementia, so that brings me into the 5-star care program that Homestead Hospice offers for patients with dementia. How is that different from the program that we're offering for the cancer patients? How do we specifically treat patients and families with dementia through your 5-star care program?
Our dementia and Alzheimer's program is very different from our cancer program in that they have different needs. When a neurological disease or any type of dementia or Alzheimer's advances, the patient is generally moving kind of backwards in time. So they're not quite as alert as, say, a cancer patient would be. So we really can't have a support program for them. We really do a big support program for the families. What we do for the patients is a lot of alternative therapies. We go out and we try to get them engaged. We do things like fold linens with them because those are the things they remember. We talk to the family about what they can remember, what they can't remember, short versus long-term memory. We try and pull things from their long-term memory. We really have to provide a lot of support in the home because as dementia and Alzheimer's advances, it can be very scary for the family, almost scarier in a way than cancer. They remember Grandma the way she was, walking, talking, vibrant, laughing. And to see her decline to the point that she's in now where she just kind of sits and is very mellow and doesn't say a whole lot, that can be very disruptive to everyone in the family. That can be very upsetting. So we gear a lot of that towards the family. And for the patient, we can send out psychiatric nurse practitioners to help with any type of psychiatric meds in case someone is having periods of agitation or they're having, good days versus bad days. We try and get to the bottom of that and make as many days as we can be good days.
And I know special training for the CNAs is important too. For instance, I was hearing someone talk to me about it's so scary for a patient with dementia to actually get into the shower. So one of the techniques that they were telling me they teach the aides is to keep their hands busy. Maybe give them some kind of a stuffed animal or something to hold that distracts them. And then there's less agitation and anxiety around that. Is that correct?
Yes, all of our CNAs are trained specifically in dementia Alzheimer's care. There are little tricks like that, and we teach these things to the family, such as, don't lean over into the personal space of a person with dementia Alzheimer's. Always get down to their level. Always introduce yourself. Always have a pleasant expression. All of these things that they do and that they teach to the families to help them care for their loved ones.
Wonderful. Let's talk a little bit about the 5-star care program for heart disease patients. What does Homestead offer for patients suffering from heart disease? I'm looking at the card and it's talking about palliative physical therapy to improve quality of life.
Yes, we do offer palliative physical therapy, and basically physical therapists will come out and they can teach. They can teach patients, they can teach families. They teach you how to do your exercises, do your deep breathing, things that are really going to, over time, help you gain or retain as much of your mobility and your function as possible.
And I know, because I lived this, and the folks who've listened to this show for a while have heard my grandmother's story over and over, but she did have chronic heart failure. And I know one of the things that we had to monitor was her sodium intake, because if she gained weight, then the swelling in her legs would be horrible and she'd be in a lot of discomfort. So do you want to talk about your dietary counseling regarding proper nutritional intake for patients with heart disease?
Yes, we have dietary counseling, and I can't believe I forgot to mention that sooner, because we have dietary counseling for many of our different diagnoses. And it's an excellent adjuvant or add-on therapy that we offer to our patients and families, because people with heart disease sometimes haven't been taught. It's amazing to me by the time they get to hospice that they haven't learned some of these lessons. If you eat salt, your feet may swell up. So it's not a matter of, oh no, I'm on hospice now, I'm going to eat salt, I'm going to eat fats, I'm going to eat butter. Well, yes, there's some of that, but if there are foods that you can eat that can make you uncomfortable depending on the disease process that you're going through. And she does an amazing job. I'm thinking specifically of the lady that works out of my office, of going out and telling you these things and making it palatable to you.
And it's important because if you have severe edema in your legs, you're even a higher risk for falling.
Yes. I mean, it can be a domino effect. If you have the swelling in your legs, you can fall. You're uncomfortable. You'll lose mobility because you don't want to walk as much. So the things that you eat really do contribute to your quality of life, particularly when your health is fragile.
And I think it's important that the folks listening to this show understand that hospice is not just about pain medicine, pushing pain medicine. There's so much more to the approach to providing comfort, like these alternative, I don't even want to say therapies, but offerings like the dietitian or the psych assessment or the alternative therapies like dance therapy and music therapy. Everything that brings happiness and joy provides comfort. And that can help extend life.
And does. Studies have shown that hospice extends life by at least 60 days in most cases.
Actually, I read that study from the Journal of Pain and Palliative Medicine in March of 2007, and what it said was, especially for patients with chronic heart failure, I think that they looked at over 4,500 patients who chose hospice versus those that didn't, who suffered from heart disease. And the patients with chronic heart failure who chose hospice lived, on average, 81 days longer.
Oh, wow.
And that's something that I want every person in the community to hear, because if you choose hospice, sometimes people feel like their physician's giving up or their family's giving up, and why are you bringing hospice? My own dad said, "What, darling, you don't want me to keep fighting?" No, I want you comfortable. I want your body as strong as your body can possibly be, and sometimes hospice can help that. Keep you out of the hospital, keep you comfortable, keep your body strong, and like in that study that's documented, perhaps even extend your time with us. And so hospice is not a lack of hope. Hospice can actually bring quality and comfort and memories that you would be robbed of if you did not choose hospice. And I'll be off my soapbox now and bring it back to you, Amanda. I think we only have a few more minutes left. I do want to reintroduce our guest. It's Amanda McKissick. She's the administrator for the Homestead Hospice and Palliative Care Office in the Cartersville, Georgia office. Homestead Hospice and Palliative Care has offices throughout Greater Atlanta and Athens, Georgia, as well as Greater Phoenix area of Arizona. And we're talking about Homestead Hospice's superior proactive care approach to providing hospice care to patients with specific diagnoses through their 5-star care program. We've talked about the 5-star care program for cancer patients and discussed how we help patients and families connect them to support groups for cancer patients and family members of cancer patients so that they can feel connected with other folks that are going through the same types of things. Or other specifics for their 5-star care program for cancer patients might also include specially trained nurses in pain and palliative medicine or IV hydration. We talked about dementia patients and how we have specially trained CNAs through Homestead Hospice that have been taught and trained how to keep a patient with dementia more comfortable and less agitated. We've talked about heart disease and how we have specially trained dietitians that will come out and teach family members and patients how to stay on top of their nutrition to prevent edema, and also then trickle down to help prevent falls and keep patients more comfortable. I love that there is a specific approach to patients' care based upon the disease that they are fighting. Because although in hospice, and I've worked in hospice a long time, we see some normalities of what everyone with a terminal illness goes through, there are specific journeys that you live through based on the diagnosis that you have. And so this specific approach, it's a blessing to be able to offer these to the Homestead Hospice patients. Is there another disease that we did not talk about, because we only have a couple minutes left to round out the show, or a lasting thought that you want to give to our audiences before we go?
I really would like to speak to what we would call debility, adult failure to thrive patients, because so many people are terminally ill who don't have a specific disease process. It's kind of a little known thing that hospice can serve those people too. So what we serve them under what we call the debility diagnosis, meaning they've had a lot of hospitalizations, they've had a lot of infections, urinary tract infections, upper respiratory infections. They've really declined. They know they're doing badly, but you can't say specifically, okay, she has the terminal illness of X, Y, or Z. We know that this person's declined a lot, but they don't have a terminal illness. So we put them under the debility terminal illness, and we can come out and we can help those people as well.
That's an important thing to note, because sometimes folks won't ask for the help that they need and deserve.
Absolutely.
Because they don't think they qualify. If you have any questions regarding whether you or your loved one might qualify for the benefits of hospice, please contact the Homestead Hospice 800 number, and they will make sure that the right person gets out to help you, even if it's just to educate you on what's offered. Just learn, educate, and be prepared to get the help that you need. And that number is 877-355-4472. Amanda, thank you so much for coming today.
Thank you,
Great
Jeannie,
information.
for having me.